Now that you've started looking into therapy, you might have been noticing that there are different kinds of therapists and there are different specialties within the world of therapy. In this video, I will be going over the different kinds of names and types of therapy that you will be running into and the kind of therapy that you would want to consider as you begin your journey into the therapy world. Hi, my name is Mosarat Yusuf Ali, and I'm a licensed clinical social worker and a therapist. It's just professional jargon for being a healer. I'm here to tell you more about mental health matters and to educate you and help you in your journey into the therapy world. In today's video, I will be going over 5 different types of therapy. I'll be talking about talk therapy, I'll be talking about psychodynamic therapy, cognitive behavior therapy, dialectical behavior therapy, and then therapy for couples, group therapy. And each of these can have its own book, own separate video. For today's video, we will only be going shortly and briefly into each one of them, focusing on what might benefit you as you are looking for your therapist and as you are trying to search the best type of therapy for you. So let's get started. The first type of therapy is just talk therapy, and it sounds exactly the way it is. You go to therapy and you talk. Using the method of just talking and storytelling, you are able to receive validation, understanding, and feedback from your therapist. Now, this has traditionally been all that therapy has known. You go to a psychologist or a therapist, like a clinical social worker, and you talk about your problems, you talk about your struggles in life, and you have somebody that can listen to you, mirror you, validate you, and guide you in your healing journey. Now, talk therapy is really a phenomenal way of transformation. If you have an attuned and mindful therapist who is really in tune with their emotions, with their feelings and sensations, they can provide you a healing space where talking about your problems will eventually lead to healing and transformation for you. So if you are confused with all the jargon out there, I want to tell you that first, don't worry too much about the type of therapy. Talk therapy in itself has a lot of benefits, and brain changes do occur when you have a good connection with your therapist. One type of specialized therapy that you might notice therapists mentioning on their website is called psychodynamic or psychoanalytic therapy. This type of therapy comes from Freud, and as a father of psychology, or as a father of, the beginnings of our therapeutic world that we are in today, Freud used psychodynamic therapy to help his clients. Now, he was also a physician and he was also a psychiatrist, so he was privy to helping clients both from a medication standpoint as well as from a therapeutic talk psychodynamic standpoint. The basic theory of psychodynamic style or approach of therapy is that we have unconscious desires and thoughts, and when we use talk and we engage in this type of therapy, we will be able to uncover and decipher our unconscious desires and thoughts, and that will bring us into healing and going to where we want to go in life and getting us into better relationships, healthier way of coping. The next type of therapy that you will see within the therapy world, or as you're looking at therapist website, is something called CBT, or cognitive behavior therapy. Cognitive behavior therapy is very much driven on changing your negative thought patterns. The idea behind CBT is that our thoughts drive our feelings and our emotions. Now, I am a big advocate of the CBT model. I love the idea that change your thoughts, change your mind, change your behaviors. And I teach that within my dialectical behavior therapy course all the time. I absolutely love helping clients see how their thoughts can impact not only your mood, it can also impact your behavior. So CBT is really driven by the theory that if we can transform our inner thought process, that's how we can bring healing into our lives. Within CBT, there are more specializations, especially people with anxiety, people with OCD, obsessive compulsive disorder. They can really tremendously benefit from CBT. Now, with obsessive compulsive disorder, it is a form of anxiety, and for that, there is another particular type of therapy called exposure therapy. However, exposure therapy along with CBT therapy can be very helpful for people that have anxiety and especially people that struggle with obsessive compulsive disorder, which I will discuss in another video. I want to share something really interesting with you when it comes to CBT. Now, in the modern world, CBT is known to have been founded by Aaron Beck, and he is kind of the originator of cognitive behavior therapy. However, we have a psychologist within our Muslim community, Dr. Rania Awad, who had been researching, and she discovered the works of Zaid Abu Bakhi, and he was you could say a psychologist, a healer in 19th century Islamic world. And when she was looking at his original text and looking at what he had written, what she found is essentially the origins of mental health. If you know, the Islamic world, the Muslim world, was already into medicine and healing, and medicine has always been a part of the healing process within the Muslim communities. And so he, in his text, he talks about a method of treating obsessive compulsive disorder. And when she looked at OCD and the description that we have today in the DSM and what he wrote, she looked at it and it was, word for word or so identical to what we today know as OCD. And then he also goes into a little bit about cognitive behavior therapy, certain components within that, and that is a treatment that was used in 19th century. So perhaps Aaron Beck was not the originator of CBT, and we have people that had been using certain methods even before it became a mainstream therapeutic and healing modality. Another type of therapy that you will discover as you are searching online is something called dialectical behavior therapy, DBT. Now, many of us in this world, we like acronyms to shorten things up. So DBT, dialectical behavior therapy, CBT, cognitive behavior therapy. DBT is a program that was curated by Marsha Linehan. And the reason I say that it was curated by her is because she was working with highly sensitive women that were they were suicidal when she was working with them. And so she was trying to do CBT, which is a change-based modality, change your thoughts. It was not working with them. And at that time was also a lot of acceptance-based model. So there was this theory of accepting and loving yourself as you are. And so using that also didn't work with her clients. So as she did her research and she was trying to answer the question of how do I help these clients that are highly suicidal and at the core, they have a difficult time regulating their emotions. So dialectical behavior therapy is a type of therapy that can be very helpful for people who have intense emotions and have a hard time regulating their emotions. These are the people that can get really angry really fast, can get anxious really fast, that can fluctuate rapidly with their emotions. There is a type of personality disorder that's called borderline personality disorder. And borderline personality disorder is a lot about regulating emotions. People that have the diagnosis of borderline personality disorder have experienced some form of trauma, and they have also experienced an environment that has been invalidating to them. And the dynamic of an invalidating environment, a sensitive nervous system, and trauma can create a person that has a really hard time regulating their emotions. And then put that person in an environment where the environment doesn't know how to teach them to cope with their intense emotions. Well, that can lead to a lot of dysregulation and a lot of misunderstanding of the self. So BPD, borderline personality disorder, can be helped a lot by dialectical behavior therapy. And there has been a lot of research to show that people that engage in dialectical behavior therapy, if they engage in DBT for 1 year, then their symptoms drastically reduce. And if they began at the beginning of the year at the treatment, having 9 or more symptoms from the DSM for BPD, by the end, they can, reduce so much of their symptoms and their behaviors that many of the criteria that they had in the beginning can go away. So DBT is a very, very helpful tool for people that have borderline personality disorder. And you heard me mention earlier that I have my own course online that people can take at their own time and pace, and you can learn DBT skills with dialectical behavior therapy. It is a little bit different than talk therapy in the sense that true dialectical behavior therapy has two components. Actually, it has several components, but I'll just describe two of them for now. One of the components is individual therapy, so the individual therapy that you do with a DBT therapist. And then the second component is you engage in skills learning in a group setting. Now, normally it has been done in a group setting. However, I found that for my clients, they had lack of resources and time, and so I created an online program so that they could benefit from learning the skills and at the same time being able to engage in individual therapy with me. So I will put a link below and you can check that out if you would be interested in that. So that is dialectical behavior therapy. It can be very helpful for people that have intense emotions and a hard time regulating their emotions. I will be making a separate video on dialectical behavior therapy as well as on borderline personality disorder. Now, another type of therapy that I'm very passionate about, which you will also see in various forms when you're looking at a therapist's website, is trauma therapy. We are now understanding more and more the impact of trauma and the impact of trauma on our bodies physically as well as mentally and emotionally. So as I was beginning this video, you heard me talk about talk therapy and CBT and DBT. Well, people that have trauma, that have experienced, whether it's shock trauma or developmental trauma, they are sometimes not helped by CBT, DBT alone, or just talk therapy. And so having a therapist that is trauma-informed is really important. And what does trauma-informed mean? Trauma-informed means that the therapist, like myself, has taken time, extra time, to really understand what trauma means and how trauma impacts the body. Within the trauma therapy world, there are different types of modality, and I will discuss two of them quickly in this video. And again, there are more out there. The two that have been researched really well and that I am familiar with are something called EMDR, again, another acronym. So EMDR stands for Eye Movement Desensitization and Reprocessing. EMDR was founded by Frances Shapiro, and I believe it was in 1987 that she discovered this type of therapy, and I've made another video about it, so you can check that out. And EMDR has been researched since she began that protocol, and she discovered it, and she stumbled upon it, and she, talks about her story in her book, which again I talked about in another video. And so EMDR started, people started using EMDR with all kinds of trauma, and there has been several research done on EMDR. So EMDR is very, very helpful for anyone that has experienced trauma. And trauma can be anything from shock trauma to developmental trauma. So shock trauma are things like sexual abuse, physical abuse, car accident, airplane crash, threatened when it comes to violence, domestic violence, war, people having to leave their country, genocide. So these are all shock trauma. Then there is developmental trauma. Developmental trauma is when you've experienced small experiences of trauma from the person that you may love and care about. You may experience trauma from the person that's supposed to be the safest to you. And so as we are growing up, if our parents didn't know or didn't have access to, best methods of training us and helping us and parenting us, and perhaps they experienced their own trauma, so they might have parented you in a way that felt normal. When you, let's say, do something bad, you get shamed, or you might get a slap on your hand, or that look. Well, that experience, depending on your nervous system, could be a traumatic experience for you. And so these little traumatic events do actually have an impact on your physical body, and that is trauma. And so EMDR can be very helpful for anyone that has trauma. Another type of therapy that you will encounter is people that say that they engage in somatic experiencing when it comes to trauma treatment. Now, somatic experiencing is slightly different than EMDR. However, there are some similarities to it. Somatic experiencing is a method that was founded by Peter Levine, and I also love to incorporate this when I'm working with clients. And Peter Levine, again, did research, and what he discovered that when we have trauma, we store that trauma, the traumatic energy gets stored in our body and usually doesn't have a chance to get released. So SE, or somatic experiencing, is a modality that gets in touch with your body and the trauma that is stored within your body. And with the help of the therapist, you are learning to release the traumatic energy from your body so that you are no longer stuck in those traumatic modes, physically as well as emotionally. So that is somatic experiencing. Now, as I said, there are many other types of traumatic therapeutic models, such as brain spotting, and perhaps in another video I will go over them. These are the ones that I am familiar with more and I utilize, and they have been there for a longer period than brain spotting. Now, another type of therapy is relationship therapy. If you are struggling in your relationship, then you will be needing relationship therapy. Now, you are either going into therapy individually, or you're going into therapy with your family or as a couple with your spouse. With couples therapy, there are different specializations within that, and I'll just have to make a separate video for that. However, I will say that if you are having struggles with your relationships, with your intimate relationships, whether you are getting support individually or with your partner, it's really important that the therapist is trained in working with couples and families. So I would highly encourage you to look for a therapist that can share on their website that they have experience and they have the skills and the training to work with couples. Some of the types of therapies that are, within this modality, there is emotion-focused therapy, EFT by Sue Johnson. There is the Gottman method, which is founded by Julie and John Gottman. There's another method by Stan Tatkin. There is something called imago therapy. So there are lots of different types of therapy when you are seeking therapy as a couple, and I will share more about that in a separate video. Another phrase that you might hear and see when you are looking for a therapist is this word of mindfulness-based therapy. So if you have heard of the word mindfulness, you might have seen that it is perhaps a trend, or that a lot of people are now using this idea of mindfulness. For us as Muslims, we have always been exposed to mindfulness within the prayer. The idea of mindfulness is all over the Quran, and thankfully we have different ways of learning. So I personally became more familiar with mindfulness through psychology. Within psychology, there is the Western scientists that discuss mindfulness and the research behind mindfulness. One of my favorite scholars is Dr. Daniel Siegel, and my journey into mindfulness has been learning a lot from Dr. Siegel and his works and his books and his trainings. And so he discovered this idea of paying attention to one thing at a time, and how that transforms the brain, and how that can help and be healing. And then he also came into contact with Jon Kabat-Zinn. Now, Jon Kabat-Zinn is another Western researcher, where he went into Eastern Asia, and he began to study Buddhism. And within Buddhism, there is the tradition of meditation. And so he began studying meditation and the benefits of meditation. And he began to put monks in fMRIs and looking at the brain scan and the brain activity that happens there. And so the Western and kind of this Buddhist background of meditation and mindfulness came together. And now there are more types of therapy where a therapist will engage in mindfulness-based practices to help you in your healing journey. Now, I think of mindfulness as a foundation of not only the work that I do, but a foundation in a way of life or a way of treatment. And so whether or not I'm actively engaging in mindfulness activity with my clients, I am having mindful attention and awareness with my clients. So I am, energetically trying to be mindful of many things that are happening all at the same time in the space between myself and the clients that I am working with. So you will notice this phrase. One particular specialty that was founded by Jon Kabat-Zinn, and you can find treatments of this online as well, is something called the mindfulness-based stress reduction program. And it's an 8-week program that teaches you mindfulness and helps you to go through exercises of mindfulness to bring you relief in anxiety and pain for those that experience chronic physical pain. One last type of therapy I want to mention in this video is something called group therapy. Now, group therapy can be extremely beneficial for exploring relationships, because when you are in a group, you begin to form relationships and connections, and certain patterns that might be happening in your real world life might start or begin to happen in a group setting. So group therapy can be beneficial for many reasons. The logistical part is that it can be cheaper to get into therapy. I know that therapy can be, costly for some. And so it can be, more cost effective to do group therapy, because group therapy tends to be a little bit less than individual therapy. Another benefit of group therapy is getting the support and the validation that I'm not alone, that what I am experiencing is universal and is not just me alone in this world. And so the connection that you find with other group members, that in itself can be very, very healing. Group therapy is a safe space to explore all kinds of emotions and thoughts and feelings. And as I said, the dynamic that you have between yourself and other clients that are engaging in group therapy, that's an amazing place to create transformation right there, to learn new skills, to learn new ways of relating, to understand your emotions more. So you might see group therapy being offered. Now, I'm going to circle back to one thing that I had said about dialectical behavior therapy. Within DBT, there is, a component of group therapy, and that group therapy is not exactly like traditional group therapy. So traditional group therapy, talk group therapy, would engage in a lot of conversation and talking and relating to the clients and your co-participants that are with you in the room. However, with DBT skills group, the focus is more on learning the skills. There is not a lot of emphasis in group interaction. And that is, very specific to the way that Marsha Linehan created this program, and what they found was helpful for people that have emotion dysregulation that are attending group therapy in DBT. And so within a DBT group, a DBT skills group, the emphasis is going to be on your relationship with your teacher, with your therapist. Yes, there will be some interaction with the other members. However, that interaction is going to be minimal, and it's not going to be exploring all of your feelings. There will be times where your therapist and clinician might say, I need you to hold that thought. I need you to hold that emotion, and I need you to regulate yourself right now. And I need you to use your skill right now. Is that the most effective way of engaging in therapy and skills group right now? Which is very different from group therapy, traditional group therapy, where you will be asked, Mariam said this, Sarah, what's coming up for you in your heart right now as you hear Mariam? So there is more active engagement in traditional group therapy, where clients are asked to think about their feelings and emotions and share. So these are some terminology and some specialties that you will encounter when you are searching for different types of therapies. I hope that you found, the brief information that I have shared in this video helpful. If you have, please give me a thumbs up and subscribe so that you can receive more videos that I will be doing in our work together. And stay tuned for more detailed information about each one of these. As I said, each one of these can really go a lot into depth, and I wanted to only give you a little glimpse of each one of them. Have an amazing rest of the day, and I look forward to seeing you back here with another educational video. Please share this video with your Muslim friends and buddies.